With the ongoing COVID 19 pandemic, millions of people are affected with this new disease. It has spread from mainland China and now the entire world. It has affected trade and commerce, which disabled vital industries, affecting employment, finances, and even the lives of the people. On this episode, we will tell you a story on what happened on one fateful day of October 1820 in then Spanish Manila, when people are suddenly dying of this new disease, where the cause of their deaths was still unknown. As we go along this story, we will uncover the facts surrounding the Manila Cholera Massacre of 1820 and how this illness spread like wildfire in our current main capital of the Spanish Philippines. As early as the 4th century, there were recorded incidents of cholera outbreaks in the world. One particular location is in the Indian subcontinent around the Ganges River Delta. However, the first recorded case of large numbers of deaths worldwide occurred during the first Asiatic cholera pandemic of 1817 to 1825, which started in the bustling city of Calcutta, then British India. It spread over other places into the parts of the subcontinent, East Asia, Southeast Asia, the Middle East, and some parts of Europe, particularly in the Caspian Sea region, killing thousands of people in the process. By 1820, the first Asiatic cholera pandemic has reached the shores of Manila. It is believed to be carried by travelers and seafarers brought about by the bustling shipping lanes, trading routes, and pilgrimage of migration of people. According to the accounts of Dr. Carlos Luis Benoit of the Spanish Army Medical Corps, reported that there were reported cases as early as September 1820. By October of the same year, the Manila public health officials, led by Dr. Benito Francia, identified the Pasig River as the epicenter of the source of the illness. Pasig River is the city's main water reservoir and also the end of the line for human waste disposal. Due to poor understanding on sanitation practice at that time, cholera spread into the population's great proportion into the nearby towns close to the city. Cholera is a disease caused by a deadly bacteria called Vibrio cholera. When a person gets sick or infected with this illness, a person can experience vomiting, body weakness, abdominal pain, diarrhea, and sepsis, infection of the bloodstream. The spread of the disease is brought about by poor hygiene, unsanitary practice of waste disposal, and contaminated food and water. In modern times, cholera is treatable using antibiotics to combat the illness. It can also be prevented by using heat by boiling the water, hygienic sanitary practice of human waste disposal, and proper knowledge and education among the people. In the events surrounding the incident, there was still little proof of medical and scientific evidence on how this disease afflicted people. There were rumors spreading around the local population of foreigners poisoning the wells, which brought hysteria and madness. The ones being mentioned and targeted on the spread of the disease are the other European nationalities and the Chinese immigrants. There was a report of an unnamed Spanish friar who started the rumors against the other foreign expatriates, which resulted into a two-day rampage in the city. By the 9th of October 1820, the chaos has started as angry mob go house to house searching for these foreigners. In the course of the chaos brought about by the hysteria, there were conflicting reports on how many died during the attack. Some would say that 28 European nationals and 8 Chinese immigrants were killed in that event. The others would say that there were 85 reported deaths of Chinese traders and a number of Europeans. In Peter Doble's account, there were 35 Europeans, mostly French and British citizens, and 11 Chinese traders killed in the melee. Peter Doble, an Irish American trader who happened to be the freelance consul of Russian Empire, later becoming a naturalized Russian citizen representing Russian Foreign Trade Mission, wrote about his experience of what happened in Manila. Foreign properties were attacked and pillaged. Even ships lying in the bay had to sail off and anchor out afar for safety. The reports are conflicting from different sources and books. The cholera outbreak attained such grave proportions that the clergy intervened to dissuade the mob against the hysteria and madness of the rumors spreading. The cholera illness brought down a lot of people and had reached its grip as far as the province of Cavite. With the cholera spreading, there are no official accounts of how many died in the cholera outbreak in October 1820 to April 1821. Some would believe over thousands were victims of this dreaded disease. However, succeeding outbreaks were also reported in some books in 1822, 1823, and 1830, but there were no official reports on how many died by this illness were written. The only written and official statistical reports were made in the 1860s onwards. The Manila Cholera Massacre of 1820 reflected a growing xenophobia and racism as its worst time among people during a time of crisis due to spread of wrong information, ignorance, lack of scientific knowledge, and basic understanding on how diseases spread, and the distaste on the unclear and indecisive leadership in the government in times of crisis, which shifts the blame to other people of different race or color at that time period. Hi, this is Ben, inviting you to subscribe, share, and like our channel by clicking the notification button and comment below. By subscribing, you are supporting our fledgling YouTube channel. Learn more for upcoming episodes on History Unfolds Philippines.